Heart attack versus cardiac arrest. What is the real difference? People use these terms interchangeably, but one is a plumbing problem and the other is an electrical blackout. If someone collapses suddenly, is it a heart attack or a cardiac arrest? Knowing the difference saves lives. A heart attack can lead to a cardiac arrest, but they are absolutely not the same thing. Here is exactly what happens inside your chest during a heart attack versus a cardiac arrest. Hello, I'm Dr. Mukul Kaushik, an interventional cardiologist. Today we need to clear up one of the most common medical confusions. Patients often ask me if a heart attack and a cardiac arrest are the exact same thing. The short answer is no. They are fundamentally different events. To understand this easily, imagine your heart as a house. This house has both a plumbing system and an electrical system. A heart attack is purely a plumbing problem. It happens when a blood vessel supplying the heart muscle gets blocked by a cholesterol clot. The heart muscle is still beating, but it is starving for oxygen. The patient is usually awake, experiencing severe chest pain, sweating, or pain. Now, a cardiac arrest is a complete electrical blackout. The heart's electrical system malfunctions, causing it to beat erratically or stop completely. Because the pump fails, blood stops reaching the brain and the body. In a cardiac arrest, the person drops unconscious within seconds. They will have no pulse and will stop breathing normally. This is the ultimate medical emergency where seconds dictate survival. While they are different, they are deeply connected in cardiology. A severe heart attack is usually the most common cause of a sudden cardiac arrest. The lack of blood flow during a heart attack destabilizes the heart's electrical rhythm. If you see someone clutching their chest but talking, suspect a heart attack. In this case, you must rush them to a hospital equipped with a cath lab immediately. But if a person collapses, is unresponsive, and has no pulse, it is a cardiac arrest. In this scenario, rushing to the hospital is not your immediate first step. Your very first action must be initiating rapid chest compressions known as CPR. CPR manually pumps the blood until a defibrillator can reset the electrical system. Understanding this difference is not just for doctors and medical students, it is critical knowledge for every single person in our community. Recognizing what is happening allows you to take the exact right action because in both of these emergencies, your quick thinking matters. Your awareness can be the reason someone survives to see tomorrow.